Today, we will be talking about the shotgun approach for treating pubic symphysis or SI joint dysfunction. This technique can be used to treat a variety of pubic symphysis or SI joint dysfunctions with an isometric abduction force targeting the SI joints and an isometric adduction force targeting the pubic symphysis joint. Step 1 for adduction. Have patient lay on their back. Flex the knees and hips so that the plantar aspect of the feet rests on the table. Start off with the knees close together but not completely touching. For step 2, try to pull the patient's knees apart and have the patient resist movement, creating an adduction isometric force. Hold for approximately 5 seconds. Then repeat 3 to 5 times. As we can see here, we're going in, lifting the patient's knees up, flexing their hips slightly so that their feet are resting comfortably on the table. Their knees are together, and we're going to try and pull their legs apart and have them resist. After holding for 5 seconds, we relax them, move them slightly further out, and then repeat the process. Then for abduction, it's going to be a fairly similar thing. We're going to have the patient start out laying on their back, flexing the knees and hips so that the plantar aspect of the feet rests on the table, and start off with the knees close together but not completely touching. Then we will try to push the patient's knees together and have the patient resist movement, creating an abduction isometric force where we hold for approximately 5 seconds and then repeat 3 to 5 times. So as we can see here, we're having the patient on their back, trying to push their knees together, and the patient is resisting by pushing their legs out. And then each time, after we hold for about 5 seconds, we are repositioning them slightly to move their legs a little bit further out and having them push again. For the exercises to supplement the shotgun technique, we will first have adduction, where the patient is on their back with knees bent and feet flat on the table. They should then take a ball or pillow and place it in between their knees for resistance, and then try and press their knees and thighs in against the pillow. So with this example, we have an old soccer ball, and so the patient will start off on their back, place the soccer ball in between their legs, and then squeeze their knees together. They'll be holding for about 5 seconds each time, and then repeating as necessary. For the abduction supplement shotgun technique, for the patient's home exercise, we're going to have them lay on their back with their knees bent and feet flat on the table as before. Then they should take a TheraBand or belt tied around their thighs to use for resistance, and then press their knees and thighs against the belt for the resistance.